Wide awake, local anesthesia, double chin liposuction. Natasha is going to have the double chin suctioned out. I'm going to make that area flat, and we're going to get rid of these, right?
Yeah.
Give them a little pinch so we can see what you're talking about. Those guys, right? Yeah, everybody hates those. I'll mark exactly where I want the jawline to sit. And this bulge in the cheek is what causes this groove by the lip, and I'm going to mark that so I can make it even with the rest of the cheek. And the final mark is where the neckline is going to end up. The local is going in. That is a 2mm little puncture. This is how we get the nice shape of the jawline and smooth out the little bumps where the jowls are. Liposuction with this really small cannula is what shapes the jawline on each side. Making that distinction between the cheek and the neck is really what makes a jawline sharp. I'll take out enough fat to make it so that it's flat, but it's also smooth. Now that the suctioning is done, there's a nice distinct jawline, and the bulge of fat that was there at the jowl is now flat enough that it's even with the rest of the cheek. This whole area has a really nice contour now. How has the process been so far?
Oh, it's been easy. Just constantly massaging. I still wear my garment at night, but it's easy. No pain.
Didn't really bruise.
No.
And that's a really important thing if you're going to have something like this, and being able to get back into what you normally do. If you got a lot of bruising, it's pretty embarrassing. So I try as much as I can, make it so the patients don't bruise. And as long as they do that and they wear the compression garment, if they do have a small spot of bruising here and there, sometimes you get one in this area. You can either cover it with a little bit of makeup or use arnica gel on the surface of the skin, which is very helpful for getting rid of visible bruising. You can see a lot flatter here, a lot more of an angle between this part and the flat part. And the overall shape of this area is much more even, so you don't have that little hanging area anymore. Definitely see the angle of the jawline. This area here, the flat part of the jawline is a lot more defined. You can see a much more even shadow, which is what people perceive when they look at your jawline and how sharp it looks. And this part of that angle is another area where even subtle differences make it so you can really see it. Nice, crisp jawline. Doesn't have that little bubble of fat hanging down anymore. For most people, they'll look like they lost about 15 pounds after something like this once the swelling goes away. It definitely takes several months for all the little areas where you can feel swelling and bumps and all that. Some of the asymmetry that you might see at the beginning takes some time to go away because one side might be a little bit more swollen than the other. There were these little bumps that were here on the jowls that make these grooves. These are still flattening out because it's only been a month, but at about 3 months there'll be significant difference with that, and that'll make that groove a lot less apparent. It's just going to keep getting better, and no one's going to know that you had anything done, which is pretty important. Nobody wants to show it off that they had a liposuction procedure. So thank you for participating. It looks terrific, and enjoy. If you like this video, if you think it was informative, please subscribe to the YouTube channel. I put new videos on there all the time, and you can see examples of different kinds of procedures and how some of the patients have done.
Also, be sure to like us on Facebook and follow us on Instagram for more pictures and information.
You'll also see little things like blog posts and other interesting informational items, so you can learn about all these things before you make a final decision about what you want to do.